worldwide affairs have a place in your day, this is the place you will want to stay. The Ron Bobb-Semple International Podcast with your host, world-renowned voice of Garvey and global news commentator, Ron Bobb-Semple.
Greetings and welcome to the Ron Bobb-Semple International Podcast. We will be addressing global issues that impact our day-to-day lives.
Going to school is the best public policy tool available to raise skills. While school time can be fun and can raise social skills and social awareness, from an economic point of view, the primary point of being in school is that it increases a child's ability. Even a relatively short time in school does this. Even a relatively short period of missed school will have consequences for skill growth. The COVID-19 pandemic has resulted in unprecedented educational disruption in the Caribbean small island developing states. St. Kitts and Nevis, officially known as the Federation of St. Christopher and Nevis, is the only federation in the Caribbean and independent member of the Commonwealth. Joining us from that beautiful twin island is educator Kishma Isaac, who lives by the motto, touching children's lives to impact the world. Teacher Kishma Isaac, greetings and welcome to the Ron Bobb-Semple International Podcast.
Thank you, Ron. Thank you so much for having me.
Absolutely. Who or what triggered your interest in being an educator?
Well, I shall say who, because when I became a mom, I always had a love for children. And then I became a mom and that love increased on a greater scale. And so I've always wanted to impact their lives on a positive spectrum, see them grow, help to train them and raise them for the future. And so that led me to wanting to become a teacher so that I can directly have hands-on in doing that.
Were you interested in any specialty?
Not specifically, no, but I love the language arts area. I love the language arts. I love speaking. I love writing and expressing. So not specifically, but if I had a choice, I would have chosen language arts. However, in the primary school section, you would have to teach all the subject areas.
You have been teaching for some 12 years now. Prior to the onslaught of the global health crisis, what are some of the challenges you have been faced with in your career to date?
Some of the challenges that I was faced with before the pandemic, and even I face them even now, are parent involvement. A lot of the times we have children who are struggling, and it is difficult to get parents to cooperate with us and to work with their children for the betterment of the children. So that has been one of the challenges, as well as lack of resources. You know, as a teacher, I found myself dipping my hands into my own little small pockets to, find ways and means to make the teaching learning experience fun and exciting for the children. Resources is a challenge for many teachers on the island.
I don't think that only applies to the island. I think that's across the global
across
spectrum.
The board. Across the board.
The socio-economic impact of COVID-19 on children and young people in the Eastern Caribbean area examines the key direct and indirect related impacts on children in the short and medium term resulting from school closure and disruption of education, increased time at home and violence levels, rising unemployment and poverty projected levels, and increased demand for social protection. I'd like us to address each of these points, Teacher Kishma. First, school closure and disruption of education.
Well, when school closed, it was, at first for anybody, if I'm honest, somewhat exciting. Oh, I get some time to relax and be at home. But as the time went on, as a teacher, you begin to wonder, what are my students doing? Who is looking out for them, especially those who would have had problems at home, whether it be on a level of having something to eat, abuse. You begin to wonder what's happening to my students. So what I did was reach out to them as far as possible using whatever online resources that were available to me. I called, WhatsApp, emailed, whatever way to find out how they were doing and in what little way that I could help, because I know that that was probably a challenge for them. Some parents, who had to work still probably didn't have any means of finding someone to look out for them, to look after them. And so it was kind of a lot really unsettling.
Increased time at home and violence levels.
So increased time at home, violence levels. Well, thankfully, I didn't experience any bouts of violence levels in relation to my children specifically, nor did I really hear of any of these things happening as a result. But I'm guessing that in the private homes, without us knowing, that the children would have gotten busy. They would have done things that they weren't supposed to do, probably trouble, something for mommy, something for daddy, done some things that they ought to have, refrained from doing. However, in terms of an increased violence, I found that I didn't really experience that. Time at home would give them busy hands.
I think I should press a foot on the word violence. I really didn't mean really serious violence. Pranks, I should have.
Oh, yes, probably that. Definitely. Definitely. I think they would have done one type of pranks. I mean, I have sons. I have 3 sons. And so they were doing, my goodness, I had to pray. They were doing all sorts of things to, pass the time, because they're not accustomed to being home for this lengthy period of time. So, but what I did, I went outside with them. I played football. We played, Ludo board games. I read to them. I had them do book reports. But, I'm a teacher, so that aspect had to come in. And so I found ways to keep them occupied. When they weren't occupied, it was trouble in Hampton. They would be up and down when they're not firing things at one another. It would be a bout of arguments. And so I really had to find ways to keep them occupied, right?
The third point, rising unemployment and poverty projected levels.
Wow, that was a hard one. It was difficult for parents and students. Well, when they came back out to school was when we noticed how hard it was, especially when you had to send home things like projects. You find that children came to school, they were hungry. And due to the fact that they couldn't leave the school compound as a result of trying to keep them safe, they had to walk with their snacks, their water, their lunches. And you found that there were some children who didn't have, our system provide school meals. But that's about it. They don't go and provide the water, and the snacks that they would need to facilitate throughout the day. And so I would have had to, provide some of these things for my children. I would walk with extra packets of biscuits, extra packets of snacks, and help them out a lot. And then children would come and cry, mommy was home crying, daddy was home crying. We don't have any food. We don't have any resources. What the school did that I really loved, though, our school, Tuckacat Primary School, we did packages. We try and got persons to, donate non-perishable items, and we pack them up and, give them to students who were really needy and even persons in the community. That was a part of our 25th anniversary celebration. So as a part of that, we try to help on that regard.
And the fourth point, increased demand for social protection.
With the students, as you know, they're children and they're social beings. And so that wasn't really a problem for them. It's not, they didn't want to, a matter of fact, it was a problem for us, the teachers, because we knew the repercussions of not socially distancing. But the students, they were found in each other's face, still playing, still wanting to share their snacks, even water. We were actually social police. We had to go around and keep saying, put up your mask, you can't touch, you can't hug. And well, that was difficult for me too, because I'm a hugger. And my students would just run to me as I enter into the school gates. They would just run to me and embrace me. And I felt so bad having to put out my hands and say, no, you can't hug, you can't touch. That was quite a challenge for me. And as well for them, even now, you still have to tell them, put up your mask. You can't talk so close into her face. You can't go so close to him. They want to sit next to each other. So that is even right now a challenge. But we just have to constantly remind them, of the issues that can come about if they don't practice social distancing. I think also that this may have an impact, a serious impact on the students' social life in the future. Because now we are saying, stay away from me. You can't hug me. You can't greet me in a particular way. And so when this is all over and done, you wonder, what kind of children are we going to have as it relates to interacting with one another, even in relationships, husband and wife, boyfriend and girlfriend type relationships? How are they going to change from, no, you have to be 6 feet away, to embrace me, love me? I wonder exactly what's going to happen. So I think that we need to have some discussions on this.
What different methods of teaching have you been forced to try to see what worked best for your students?
Well, of course, we know as a result of the COVID, we have to go online. We tried, I think, this system called MS Teams. I am not 100% familiar with it. And I was thankful that we didn't actually have to use it. Praise the Lord, by God's grace, we still haven't had to use it. But we were forced to learn the in and outs of MS Teams, of Zoom. Mostly MS Teams, the government implemented. We had to learn how to set up chats, how to post assignments, how to, navigate online. We have to come up with lesson plans that would integrate the online learning, innovative ways of how to keep the children interested and with you. Because even in the classroom, it's sometimes difficult to keep children still interested in what you're saying, keep them hands-on and, ready to learn. Online now, where they can just mute themselves, turn off their camera, and to show what they're doing if they're lying down on their phone, that was a challenge. So I'm grateful that we didn't actually have to. Well, me personally, I'm sure that some other schools would have had to do that, but our school was so big that it was difficult to get them all on MS Teams at once. So we didn't have to do that.
I think you've led me into my very next question. In a survey taken in the United States, some students say they were initially excited about the idea of virtual education, but quickly lost interest in school and struggled to pay attention. Have you experienced that in St. Kitts?
Personally, no, but from my colleagues, yes. There were even jokes circulating where the child would screenshot themselves in the classroom and post the picture. So when the teacher thinks that the child is there seated, being quiet, listening, there's nobody there. And they found that it was difficult to put across the information. As a teacher, I didn't experience it, but as a mom, I did, because my students go to the Seventh-day Adventist primary, well, at that time, the Seventh-day Adventist primary school. And so my youngest son had to do online learning, and he would be with his hand under his chin and he's looking completely bored. And I would have to, tap in every minute and say, Jeremiah, listen, pay attention. It was difficult. He would say, Mommy, I miss my friends. This is not fun. I can't see my teacher. And there would be challenges, of course, in terms of internet disruptions. Some persons can't get to log on. Some persons aren't familiar with the technology. And so that was a bout of problems for parents, teachers, and students.
In another survey, teachers say they feel helpless in helping their students cope because they have not been able to process it themselves. Doesn't this add additional stress to already fatigued educators? Some have said, quote, instead of worrying about surviving teaching, we are worrying about surviving the virus, unquote.
Have mercy, Lord. Well, what I would say to that is our health is our wealth, and we need to put that first and foremost before teaching. Of course, not before God, because He gives us health. But we definitely need to put our health before teaching. And so we have to cultivate a mindset of hope. We have to cultivate attitudes of gratitude. We have to be thankful that although all of this is happening around us, we are still here. And what we must do is try to follow all COVID protocols, social distancing, sanitization, and understand the importance of it all. Yes, it's difficult to worry not only about finishing the curriculum, about the children that are set before you, but about, imagine you're entering the classroom and you're wondering, am I going to catch COVID today? That is difficult mentally, physically, psychologically, all of the uneasy. So I'll say keep positive, pray, have, buddies that you can speak to about what's happening to you, have groups where you can express different and innovative ways of teaching during this pandemic, and just be thankful. Just be thankful and hopeful. Oh, and do not listen to everything you hear on the news. Try to stay positive, because what might be my experience in St. Kitts might be a total different experience in America, in India, in all the different parts of the world. So we have to try and be positive in our own spaces.
School closures have left 7 million learners and over 90,000 teachers across 23 countries and territories in the Caribbean subregion grappling with a new reality of distance learning. How much communication is there with other educators in the region as to how they are being affected and handling this crisis?
Well, to be quite honest, I haven't had any communication with other teachers in the region. I've, of course, spoken to my teachers here in St. Kitts and asked them, how are you coping? What are some of the techniques that you're using? How can we help each other, right? And due to the fact that teaching is now going online, we are able now to share a lot more prep, a lot more activities, because we can now email it. Okay, this is what I did for this subject area. This is what I did for that subject area. But I think that's an awesome point. We should probably try and reach out somehow, whether a part of the OECS, the CARICOM, somehow reach out to each other and have discussions like these. How are you coping? Because it might not be that bad in St. Kitts, but what about Antigua? What about the different Caribbean islands? How are they coping? How can we help each other? And that is how we are going to get through this, helping each other.
Speaking of not bad in St. Kitts, I could not wait to get to this part of my questioning. In a recent Ministry of Health press release, these numbers were shared with the populace of St. Kitts and Nevis and on social media to the world. By the time this episode of the Ron Bobb-Semple International Podcast is aired, the following numbers surely would have changed. In St. Kitts and Nevis, total number of confirmed cases, 45. Number imported cases within the last 14 days, 1. Number of deaths, 0. Number of persons tested, 13,904 out of a population of just under 54,000 people. Number of positive test results, 45. Number of negative test results, 13,847. Number of test results pending, 15. Number of persons quarantined at home, 6. Number of persons quarantined at a facility, 815. Number of persons in isolation, 1. Number of persons released from quarantine, 8,794. Number of persons recovered, 44. How has the administration of the Prime Minister of St. Kitts and Nevis, the Honorable Dr. Timothy Harris, been able to have this kind of control over the spread of this global health crisis?
Well, I would have to do some more research on that as to how he is getting that done. I am guessing that he is, this is my thinking, that he is trying to educate persons as to the risk that would happen if we don't social distance, sanitize, and all such like. He's also kept the 14 days quarantine in place, where if you travel, you come back in, you have to be quarantined for 14 days. Or if you come into the country, you'd also have to be quarantined for 14 days. So I am guessing that that would have also helped. And where they would have allowed persons to quarantine in their homes previously, they're now mandating that you quarantine in a government assigned facility, whether it's a hotel, a motel. And if you want to stay in your home, they're now increasing the price for that. So they can now look at that and have more coverage, have it more secured. I am thinking that that is a part of how he is getting this under control, keeping this under control.
What is the general reaction from Kittitians and Nevisians about this health crisis?
The general reaction. Well, I can talk about my reaction. It was flabbergasted. When we heard about this COVID pandemic, it was nothing like we've ever heard before. I wasn't living during the days of all those other pandemics. And so this was my first. And on such a scale, it was completely frightening. You wondered what would happen next? Would the world go back to being how it was before? And so I'm sure that you're saying no. I don't think so either, Ron. I'm thinking, what's going to happen to my children? That was one of my first thoughts. What will happen to my children in the future? What would they have to undergo? What would they have to do in order to survive after such an awful experience? For now, as the numbers seem under control, it's not as troubling here. However, you're still wondering, are these the real numbers? Are they being transparent?
Good point.
Is it what they're saying it is? And so you have all of these questions and you don't have ready answers for them. But as I said before, you just have to stay positive, stay hopeful, stay grateful.
46% of CARICOM member states are reporting community spread, and there are reports of the SARS-CoV-2 variants of concern in the region. However, the Federation of St. Kitts and Nevis is aiming for a full reopening in October of 2021. Congratulations to the government and people of St. Kitts and Nevis with a motto of country above self. Teacher Kishma Isaac, thank you very much for joining me on the Ron Bobb-Semple International Podcast, and all the best to you in pursuing that BA in Education Administration with a minor in psychology.
Thank you very much, Ron.
You're very much welcome.
I was very happy to be here. What I want to say is, let us all stay prayerful, hopeful, and positive, and we shall get through this by the grace of God.
Without a doubt, and those 3 words that you used earlier, well, maybe 4, cultivate attitudes of gratitude.
Yes.
I thank you.
Indeed. You're welcome.
It's time. Life is a place where disappointments are bound to happen. You realize that the only thing you can do is embrace them and learn from them. It's time to stop beating up yourself about the past and embrace today and the future to come. It is time to let go of what's lost and what could never be. You are only hurting yourself and hampering your happiness. It's time to start loving yourself to the max. Stop letting life slip by because of your fear of challenges and mistakes and disappointments. It's time to live. You don't know when your time will end, when your loved ones will lose you. It's time to laugh. Laugh when you are sad. Laugh when you are depressed. Laugh when you are down. Laugh at hard times, failures, and at life. It's time to love. Don't ever stop loving because you have had bad relationships. Learn from them and move on. The right one is out there somewhere. Don't give up looking. It's time to stop selling yourself short. Always know that you are worth it and you deserve the best. Yes, be mindful of what you do and how it may affect others, but keep your best interests at heart. Encourage yourself. Always tell yourself that you can do it. You are the only one who can stop your happiness. When things happen, cry. Yes, cry. Let out all the hurt and pain. But don't you dare let that be the end. Take a towel, dry your tears. Look at yourself in a mirror and smile. You have reached the end of a situation. Now it's time to press on. Life does not end there. More situations will come. Get back on the road and drive. Run over speed bumps, knock down hurdles, break through boulders, and face your destiny. Life will go on, whether you are happy or sad. sick or well, dead or alive. It's time to choose to be happy and move on with life. Live, love, laugh. My name is Kishma Isaac, and it's time.
Thank you for spending some time with us. If you are so inclined, you can subscribe to these podcasts and donate to them by clicking on the Support the Show button on the website. Please continue to protect yourself and your loved ones during this global pandemic by observing all protocols. Be safe, be strong, and be aware. I'm Bobb-Semple.